Let's also put that news of GST reduction on health insurance into perspective with Dr. Bhabtosh Mishra, the Director Claims Underwriting and Product at Niva Bupa, joining us on the show. Hi, Dr. Mishra. Thanks so much for making time and speaking to us. First up, help us understand this GST reduction. If it does happen, how big a fillip will it be for the health insurance industry, and what portion of the industry right now is actually catering to the senior citizens?
Right. Thank you for having me here. Thank you very much. If this GST reduction specifically for the segment of senior citizen happens, then it will be a fulfillment of request, desire, and demands of the insurance industry, which have found a lot of support from various quarters. One of the reasons being that senior citizens, at that age, income suddenly drops. And the need of health insurance is perhaps the most in the segment of senior citizens. We are a young country, but nevertheless, our senior citizen population is in excess of 100 million and rising fast. Now, their affordability concerns are a big issue, and 18% GST on health insurance was coming as an impediment in accessing health insurance products for the senior citizens, which is very essential for this segment anyways. Now, one way to look at it is what segment and what percentage of senior citizens are already covered. But the real way to look at it, in my opinion, is that how many of senior citizens, where I have a strong belief and reason to believe that they want this product, but are not being able to buy it simply because it is becoming unaffordable for them. And a significant reduction in GST, which is 18% today, will actually bring forward a large segment of senior citizens to buy health insurance products, is what I strongly believe.
Do you think, Dr. Mishra, that this kind of a move will easily go through the GST Council because it's beneficial for both parties?
It will. I think everybody is sensitive to the fact that the country needs to take care of the senior citizens. Healthcare need is one of the highest in senior citizens. Healthcare inflation and cost of treatment rising is a reality that people understand. And globally, it is known that health insurance is one of the strongest and the most potent tools to meet with foreseen and unforeseen healthcare needs. And that way, I think it is going to find very strong positive voices across, including hopefully with the council as well, is what I hope.
Could you tell us what kind of growth rate is there in the industry right now? Because of late, the pricing has been one of the challenges. Apart from GST itself, the pricing of insurance has gone up as well. What's the industry doing about that?
Several measures, actually. One thing we need to realize is the premium or the price of a health insurance product is driven largely by the healthcare cost or the claim cost. Now, the claim cost in health insurance products, looking at various companies as an industry, would be in excess of 65-70%. That's a real claim cost. And the healthcare cost rising with a significant inflation that we have seen, excuse me, through the period of COVID and after, is something which is a reality, which has hit the healthcare cost badly and consequently the health insurance premium. Now, how the industry is responding is by trying to avoid significant increase in premium for senior citizens by giving multiple choice, a range of products from a very basic to an absolutely comprehensive, including OPDs, etc., so that choice is available to the consumer. A lot of measures like offering deductibles, including very small deductibles to start with, like 30, 40, 50,000, and giving copay options, to play with features to basically create a product that not just fits the need, but also the wallet, is something the industry is doing. A lot of product innovation, and regulator has been very proactive and vocal about easing up the product filing process, which has moved to an use and file now. So it has given insurers this flexibility to bring all these choices to the consumers and specifically to the senior citizens, that they could have these products as they need and fit their bill.
Okay, Dr. Mishra, great to have you on the show and get in that perspective. Let's see when this news actually comes about and when GST on health insurance for senior citizens actually stands to get reduced.